massive a bit. We're going to practice doing some posterior cervicals and stomach occiditals, all that kind of crap. We can do this wave. When you do the wave technique, it shouldn't, yeah. So engage like that and gently, it's like a PA in the back of the neck on one side, gently, so we can treat it that way. We can go into toddler. Yeah, do a scombries. Now, we had this conversation earlier on with the scombries, and I'll show you what it should not look like. It should not look like this. Any of those elements are wrong unless you're doing jiu-jitsu scombries, where you're holding the person down like that and you're pinching with your fingertip like that. Now, that's not going to work. Okay? So what we're going to do instead is we're going to do this.
So force your knots, forget them.
No, they didn't. No, breathing never did anything like that. Now I know, because I have a breather release my scum a lot of times. You never did that. So you're going to hold this.
That's what you were showing.
What?
Sensor.
Who showed you that?
Pinch it all the way along.
Yeah.
Who showed you that?
Breathe that.
No, I don't breathe do that in my neck all the times. Maybe that's the syllabus that she's teaching us. She doesn't do it at home. Like I breathe treat, right? I've got loads of people that breathe in. So if you get the head this way, you can kind of control the head a little bit better. You can shorten up the scum to put a bit of slack in. So you okay there? And instead of using this, you're going to use this. Broader grip, broader contact, and pick it up, move it around, and let the patient get accustomed to that. Then from that position, if you need to stretch it, you can stretch it. Okay, let's do the stretching is gone. Now, if we had a BBI problem, would I be affecting the carotid artery, vertebral artery?
No.
I'm not even at 45 degrees, sure I'm not. But can you feel a stretch of that? So we can kind of, do you know what I mean? Do it that way. Does that feel okay? Your head feels like it's relatively stable in there, does it?
Yeah.
You got the arm there, you got this, you got lots of headrest, you know. And if the patient, you know, you shouldn't have them too much extension or anything like that, you know, kind of flexible, but then open it out later on if you warm the muscle up a little bit. So, you get the idea? I came to this because poor Rafa earlier on just got his neck attacked the moment when he was like getting battered and he was trying to look all calm and nice, you know, and he was feeling it. So there's a scum release. Yell scalene release, whatever you like to do, kneading through the scalenes, any of that stuff. Avoid maybe doing a lot of stripping on the neck till someone has a big red welt down the side of their neck. If you're going to do that, bring some moisturiser with you, and if you want to do stripping, so I don't care if you do it or not, if you like doing it, do it, but don't just kind of dry shave the side of some poor fella's neck that we don't like, that we've had that enough ourselves in this day and age where we're learning how to shave, we don't enjoy it, that's all. So that's that. For the traps and stuff, we can get in here. You okay there?
Yeah.
Don't worry, I'm not going to back again. And the trappers, are we okay there?
Yeah.
Now to loosen up the joints around the upper thoracic spine and the first couple of ribs there, what do we have that'll kind of rock them and loosen them up? Why not? Why not? You guys asked for techniques, you got it. Is it okay if I put my hand across there? You know? Okay, if I could. You sure?
Yeah.
Okay, yeah. Just pull that up there. And we can do some massage and movement that way. That feel okay, don't you?
Yeah.
What should it not look like? Okay, so you're going to lean back and just slow it down and work through. It's a bit tricky when you're working through someone else's hand, but there you go, like that. So you can loosen up the first couple of ones there. Now, if it's the first rib, we've got this mobilization we like to do. Oh. So you're going to use that there. Try and get that joint on, as close to the first rib as you can get it. So we are going to side bend away, or sorry, rotate away, side bend towards, and push in. So I want to push that first rib down. Let's say I'm imagining it's stuck in an elevated, theoretically elevated position, which is quite bonkers. But anyway, we're going to rotate away, side bend towards, and I'm going to push down that way on that first rib. And you could do that as a minute, but we won't today, okay? Like so. Get the idea? Perfect. There's a kind of treatment you might do for the first rib in that area in there. And then we might sit you up, Julie, and we'll do a reverse nag. So if you have an upper thoracic thing, do a reverse nag. Where does a reverse nag go wrong? You don't do that, you have to do the thoracic, you do that one there, and that's just the common kind of stuff we see. I said this morning when I was doing this, I pity the fucker's going to get this at 5 o'clock, whatever. Sorry, Julie.
No, it's not Julie. It's me.
Oh.
Yeah, 5 o'clock, Saturday.
Oh, it's you?
Yeah.
No, I think it's me,
No,
so don't worry. I thought it was me.
Yeah, no.
Wow, you're pretty self-conscious, but aren't you? I'll play on that next time I want to wind you up. I'm going to do it. Yeah, so like so. No, it's definitely me. Judy's nose is right stuck in it. She'll be passed out by the time she guys comes in. You're alright there, Judy. Hold them together. Yeah, that's pretty much.
It's not too bad.
But it's still bad, yeah. The treatment are the bit.
You can't do that anymore. Then you can go and discuss each other. So, and have you worked through that kind of treatment there? Okay, and oh, we did a little gapping while we're here. We're waiting for the crack. I'm not doing upslope because this results in arguments. So hop up here originally. If you do it halfway between something what me and Charlie do, you're fine if you do an upslope that way. Don't be worried. So, you might do, while we were in this position, you might have done this kind of technique there. Provided there's no contraindications or anything like that. You okay, Julie? And you can do a little gapping technique. Put that into practice there for the crack. That make sense?
Yeah. What's more specific, gapping also?
Specific is, do you mean?
To the area you want to treat, so C4 or...
Depends how good you are doing it.
Okay.
Obviously, the sort of specific is usually specificity of a test and compared to a gold standard, right?
Okay,
But
so which
for that, no, this is not a test, so it's a technique. So, can you localize it well? Well, the theory is that if you're a magic manual therapist, you can localize exactly to the level you want. The reality is that probably when you crack something, you crack a load of stuff. I've even known cases of this person that was a very good manipulator that used to crack his own knuckle if he couldn't get a joint to go on the patient. So he'd crack his own knuckle. They all have this. So I've heard that's just true. Like that's the thing.
10 out of 10.
Yeah, it's like he's having a little goof. He's having a little goof. So Mike can tell you that one. So you kind of yeah, it's pretty interesting. So but the reality is, for example, there's a lot of people would manipulate pelvises and they would imagine the pelvis, the sacroiliac joint is cavitated, and maybe it's L fucking 3 out 2 or something like that. Who do you know? So which is more specific? Practice really well. I feel like I can get it really into that area there and kind of stretch it, or I do it quite well. It feels right to me, but how do I know it's not just in my head? When we get a functional MRI that'll fit me and a patient in, standing up doing that, then we'll know. Until then, we'll